Welcome to Reaction. Today we're talking about COVID, the COVID crisis, and just really trying to assess where we are in terms of the politics of it in the UK. Things seem to be moving. Some concern about the numbers, and there was the first Downing Street press conference in quite some time yesterday with the Health Secretary Sajid Javid. I'm Iain Martin, editor of Reaction. I'm joined by my colleague Alastair Benn. If you're not a subscriber to Reaction on YouTube, just click the subscribe button below and also like this video. Alastair, where do you think we are after yesterday's performance by the Health Secretary?
Well, we're embracing Plan A for the moment and not going for Plan B, which is, I'll let you come on to that in a moment, Iain. But it reminds me of Dominic Cummings, actually. His narrative about in March and April last year, the government pitching to Plan B, which he had worked up with sort of clever data scientists and with input from mathematicians like Timothy Gowers, even though half of Europe had gone into a lockdown a week earlier. So, don't think it was Dominic Cummings' idea. But anyway, please, can you take me through what the government's reasoning? Why are they sticking to Plan A if they've got this wonderful Plan B? What's the reasoning?
So we should explain the difference, shouldn't we, between Plan A and Plan B?
Yeah.
So Plan A is kind of now, which is a back to normal with some vigilance approach, and then Plan B, if it's required at some point, and if the numbers get considerably worse and they fear that the health system is going to be overwhelmed, then they'll move to further restrictions. There's a lot of hype at the moment about will Britain go back to lockdown. It doesn't seem to be that. I think it would have to be something fairly catastrophic to get to that point, but it's more like restrictions on gatherings, compulsory mask wearing in certain settings. At the moment they're trying to restrict it to advising people to behave as sensibly as possible. Look, I mean, this is the government that went for Freedom Day and wanted to make a big play of getting as back to normal as possible to try and undo some of the economic damage. And also, I think, just born of a belief that the Health Secretary has and the Prime Minister shares, that while the measures last year and early this year may well have been absolutely necessary in terms of combating COVID, at some point you have to learn to live with it, that fabled phrase. So I think that's where they are. I would criticize them in one respect. I mean, I think what they're doing is to their credit. I know there are a lot of people on Twitter shouting that it's a disaster and you have to move as quickly as possible to some aggressive measures, which I think just discounts the fact that things are very different from 18 months ago or even this time last year. This time last year, we knew that a vaccine was coming, but it wasn't coming for 4 or 5 months. I mean, so we are living with the vaccines, which bring with it an entirely different set of philosophical assumptions about how we should handle it. So I think that's to their credit. Where I would question the way in which things are going, I would question them on boosters and the public information side of things, which had been, I think, very strong in the previous vaccine rollout. They seem to be lagging a bit on getting boosters out, and it's not going quite as fast as they would have thought. I think there is some public confusion about how do you get your booster? Do you wait to be called? Who's handling it? It's not GPs. It seems to be being done centrally. It seems to be being conducted almost, when you talk to people who are waiting for it, by WhatsApp group with people sharing information, rather than there being a strong message about when you can expect to get it and in what order. Do you think that's fair?
I think that's absolutely fair. I think where I would take you up on is the kind of differences in the situation. And I don't think it's just the vaccines that are the difference. I think we are living in a world where social distancing or non-pharmaceutical interventions, as they're often labeled, we're living in a world now where their record is being tested in real time with real sort of country by country comparisons. And I think the record is profoundly mixed in terms of what social distancing is achieving in heavily vaccinated populations in Europe. I mean, take Scotland, for example, which has retained many of the kind of basic measures that the kind of public health kind of voices often advocate for. And its experience of COVID in the last few months has been broadly similar to England, because there are other factors, deprivation in Scotland's old industrial West, all other factors which have contributed to inability to work from home, all that stuff. In Europe, yes, some countries have much lower COVID rates than us, France or Germany, but there are plenty which have, in the Baltic states and in Eastern Europe, which are not, which are sort of portrayed sometimes in the media as if they're kind of sinkholes with, where these things are just impossible. But these places have massive non-pharmaceutical interventions, vaccine passport systems, compulsory masking, and are experiencing quite high rates of COVID comparable to over here. So I think that it adds to the kind of inherent complexity of the debate over social distancing as we're having it at the moment. People are sort of being able to read the runes for themselves and manage their own risk like that, I think. And that adds something to the picture.
What do you make of the numbers? Because, I mean, look, we've been through the crisis together, talking and writing about this. Actually, it's interesting. We've been on these reaction YouTube videos and podcasts. We've been talking primarily about other things for months, haven't we? Really, there's been so much else going on, and I wonder if that's a bit of a factor with the government as well. Actually, in the UK, just that if you look at the news agenda since the summer, I mean, it's really dominated by Afghanistan, reshuffle, build up to COP26. The biggest story of the lot has been concerns about supply chains and energy. So I'm not excusing them. I'm simply explaining that a lot else has been happening. But so we covered the crisis together and talked about it a lot, and were concerned a lot about the coverage. Now there's all sorts of screaming out there about the numbers on Twitter. How are we to read, do you think, the fact that Britain seems to have pretty high numbers relative to, I know you mentioned some other countries where that's not the case, but relative to similar sized countries in Europe, Britain's got a lot of COVID.
Yeah, but you look at the numbers ever since sort of the Delta variant arrived here and sort of gained traction. We did have a very fast sort of exponential increase in numbers in July, to some extent, I think, inflected by the fact we had a massive football tournament here with huge social gatherings, encouraged by the PM and everyone. That we had made a trade-off, right? People wanted to watch the football, but a lot of people got COVID, and most people were ready to make that trade-off. Since then, it's gone up and down at quite high levels. You look at the numbers at the moment, and the rate of increase has slowed and is potentially sort of, it's still increasing, but not as much. And the rate of increase might just be about to turn. Again, don't know if that will happen, but it's not a frightening increase, even like we saw in July, where it was going up very, very fast. And so, yeah, I would say I would very much agree with actually, some of the voices from Sage at the moment who are warning, look at the actual situation. We're doing a huge amount more of testing in schools. A lot of these people haven't been vaccinated. That wave was always going to happen when schools came back, basically effectively back to normal. That will probably peter out in a few weeks. And we've got to, I think, throughout the whole crisis, I think everyone's got a lot wrong, but I think we've been good on the podcast about trying to talk about what the real issue is at stake. Like what's actually going on here? What will make a difference to to the problem. Now, the calls to, for example, introduce mask mandates on public transport do not make a difference to the problem we are talking about. They might make a sort of amorphous difference or make people feel better, but the marginal, crucial difference is not going to be made by enforcing working age adults to meet outside sometimes. It's, the problem, if there is a problem, is schools being back to normal and a lot of teenagers getting COVID. Hopefully that will stabilize, but that brings us into a more fundamental argument, which I think the government is right to sort of stay clear of, but I think is the fundamental one, is over the next few months, are working age adults going to modify their behavior on the basis that a booster campaign doesn't deliver, or that cases are rising in elderly people don't come forward for their boosters? If that is the trade-off we are all willing to make, i.e. not changing our behavior as working age adults, then we're going to have to accept a degree of mortality in the general population, which we need to argue about. That, for me, is the trade-off. Do we want to continue in this return to normal where we're slowly getting, we have things like gatherings or be able to play sport or all that, or do we want to go back to social distancing, and this is as working age people, because this is.
But hold on there. Yeah, no, I understand the distinction, and I can see why should people. I do. I'm in the camp that would say that people should try and be as sensible as possible and just through the exercise of free will, try and avoid reckless behavior. I understand that. Though I can see philosophically why some people want reckless behavior back. Actually, it's part of life. But why should people alter their behavior because X number of people in the population, I think 5 million people over 16, won't have the vaccine at all, and then some people are also vaccine hesitant on the boosters? There's a question there about. We don't know yet how serious that problem is, because there is the problem with the rollout, or the rollout is slow. But what is it that you think we should do? What should the national policy be? Is it a question of advice, urging people to be sensible, as I said, or do you think something more draconian than that is required?
I think they're sort of. I agree with you. They're doing the right thing at the moment. Plan B, I would love to sort of see, understand what the kind of wargaming is in terms of Plan B. I know over the summer that they were doing a lot of contingency planning. It was sort of leaked into the media a little bit, and there was a piece in the Eye about it about a month ago about plans for contingency planning, lockdowns, all that. Well, I think in the end, we're not going to go back to something like tiers and lockdowns. Although I think tiers actually worked a lot better than people gave them credit for. I think we need to think back a year ago what happened in the autumn, and there's a lot of rewriting the scripts about what happened over that year. People said we should have had an autumn lockdown that would have ameliorated or stopped the second wave. In vast proportions of our country, Manchester in the northeast, northwest, Leicester in the Midlands, a lot of the country was in a effective lockdown for months.
Yep.
Effectively from October. And Leicester longer than that, and didn't do much to ameliorate the COVID case rates. Fluctuated, it went down sometimes. Great stats out there about who can work from home. So, in places like Leicester, very few people can work from home easily. It's not that kind of economy. Mm-hmm. So, and that's the real thing that I think makes a massive difference in COVID, is a large part of the population being able to effectively work from their living room to no problem. And that's why in London, I think it works a lot better. So I think that's actually what, if there's something that we need to do, or it's worth doing, it's encouraging working from home. In parts of the country where you really want to slow spread. Will that change the fundamentals, i.e. the relative deprivation, the health inequalities, and the fragilities that actually drive significant mortality from COVID and facilitated spread? No, but we are, that's a 10-year project, 20-year project in thinking about how we get more resilient in health. But that's my view.
Yeah. Do you think that we just need to, maybe this is part of a longer term effort where essentially we need to adjust our model, our social model, in terms of how we regard winter? I mean, I can remember how strange it looked two and a half years ago, or whenever it was, so just before the crisis or as the crisis was starting, to see tourists from Southeast Asia wearing masks on the tube and thinking, well, that's ridiculous. You don't need to do that here. But thinking back 20 years ago, I can remember in Tokyo seeing people wearing masks because there was sort of flu on the go at that point, and it just became it's something that just it happens automatically at certain types of the year, and there is people are hyper vigilant to it, and they wear masks, etc., and do socially distance as much to just send a signal that they care about those around them, and that they are paying attention. So if you add together the cold, which lots of people have had, I've had, and flu, which seems to be on the way, sadly, and COVID, you add those three together, do we just need to accept, because of course winters have always been, in Northern Europe since October, around October everyone starts to get colds. Do we just need to go to the Japanese model, that is just how you live, being alert to these things from about now to March?
Absolutely. And it makes sense for a lot of people to be alert to those things. I think especially if you're feeling a bit grotty, putting a mask on and sort of illustrating to people on public transport doesn't mean you have to stop your life for 10 days or isolate. It just means, just doing as much as you can in the circumstances where you are. Very few people, well, not very few people, but people who can afford to isolate for significant times from illness are pretty far and far between, in terms of people's actual jobs and all that. So yeah, there are things we can do, and I think it's about politeness. But there is also a kind of, I think that's where we need to get. But at the moment, the debate, I think still there is a kind of 20% of the population that are perfectly fit and healthy, but are demanding a particular corona politics or kind of biopolitics which fits their assumptions about class and their assumptions about, I think about kind of geographical segregation and their assumptions about where they want to live and what kind of the good life looks like. And that's fine, but they should sort of be ignored. There are the people who are facing severe problems in terms of they're immunocompromised.
Yeah,
they feel very vulnerable. These are the people we should listen to, and I think that's part of the kind of cultural evolution that we're going to have to go through.
But Alastair, that's what concerns me, and a lot of this is fought out on social media. Not everyone's on Twitter, but a lot of people are. So last night, I was discussing this with various people because I would like to be. My politics is such that I would like to believe that the sort of sensible exercise of free will and collaboration and cooperation would lead us to something like the right policy. There are always exceptions, but that people will find a level and a way of behaving themselves without excessive government compulsion. And one reaction, long-standing reaction subscriber came back and just said, "Look, that's just hopelessly naive, because millions of people, not the majority, but millions of people in the crisis have proved that they can't sort of think for themselves, and they do need that element of compulsion." And I was just about to disagree with them, and then I remembered that I'd been on the train coming back from town earlier in the week, And there was a guy behind me having a classic sort of boring, loud business conversation about his stupid meeting, and he was coughing throughout it. And people were disconcerted. I got up and moved along the carriage, and various other people did. What on earth, after the events of the last 18 months, is someone thinking, whether it's a cold, whether it's flu, or whether it is potentially COVID, what on earth are they thinking getting up in the morning and going into the office with that cough, and then sitting on public transport and having a conversation, or exacerbating the effect and coughing during the conversation? How on earth can you have lived through this period and still be doing that?
Well, he sounds like a moron, but I think most people aren't like that, and but I'm really talking about the demands for the kind of 5% of people who don't wear masks to suddenly wear them, and that will improve things. Because there's a lot of arguments about masks on public transport, and yeah, I get it. I live in London, and I wear a mask when I go on the tube. But you know what? I often don't wear a mask when I'm on the overground, and it's completely empty because I'm a human being, who understands that I'm not going to be infecting anyone who's 10 meters away. But
Yeah.
I think most people are very sensible about that. Every time I go into a crowded tube, basically everyone's wearing masks. I mean, there's like 3 people who aren't, but it's the same on the overground. If it's crowded, you put a mask on. So I think there is this sort of odd exception where you just think you're just not listening, or you're not part of that kind of cultural evolution. But I think in general, people are trying to do their best, and
Yeah.
I don't think I think I've had quite enough of the kind of compulsion in terms of changing attitudes, because I think that has been salient.
Yeah.
But yeah, I think the danger, I, the dangerous side of this is that we're not inflecting enough a kind of narrative that says everything would be better if people were more careful when they went into the office with colds and flus, and that's going to be the main, that's going to make a big difference in the years to come, because that to me is not the fundamental issue at stake. It's the fact that there are very many people, even people who work in the NHS, who who have to go into work even though they're feeling awful, who cannot afford to do anything else, people who work in delivery or in restaurants, who
Yeah.
are in casualized labor, all these kind of fundamental issues with our economy that have made tackling COVID a bit of a Gordian knot, because I think a lot of the stuff that the media class talks about in terms of making a difference, I'm just like, yeah, I mean, it makes a difference in certain contexts, but let's kind of think about the whole system of British social life, and it seems to me anyway, that doesn't make a huge amount of difference where the disease is impacting vulnerable populations or people who live in real deprivation.
Yes.
And I think that's what the argument over working from home. I think I totally agree with you, and that evolution has to happen in terms of people being more careful about respiratory viruses. That doesn't mean not getting them, but that means just being a bit polite and respectful. But I mean, that's only, I think, one part of the picture.
But it's pretty difficult to work from home if you're on a 0 hours contract, working in a major, working for a major retailer in a large warehouse. Listen, I was about to say that it's been good to get back talking about COVID, which, well, I mean, it has been great having this conversation, Alastair, but it's been good not talking about it for the last few months. But I suspect the politics of COVID and how the government's handling it and all of that, we're going to be talking quite a bit about that in the months ahead on Reaction on YouTube. If you're not a subscriber to Reaction on YouTube, just hit the subscribe button and also like our video. And if you're not a subscriber to Reaction in general, visit the main site and you get my weekly newsletter on politics, and you get columnists including Tim Marshall on geopolitics, Maggie Pagano on business, and lots more writing from the team and invites to events. So the details are below, and there's an offer on at the moment for our annual membership. Until next time, thank you for listening.